I'm doing a postgrad paper at the moment, and it's nursing education. I have to do a oral presentation before I can do my last assignment, which is a 4,000 already, so thank you very much. So mine is going to be on infection control and prevention and IV therapy. Okay, so let's get going. I haven't used this thing before, so it's a bit of a mission, but anyway. Okay, so you have got your hand out in case it's a bit hard to read. So,
Take the sheet off, you reckon?
Yeah.
It looks quite good on the back.
Yeah.
Behind the sheet.
But there's
Yeah.
a painting behind it.
Oh,
Put some holes in it, we'll just pin it up.
actually,
Unfortunately, it would have been worse on this side if I'd turned around.
yeah.
I think you can see most of it. So we're going to go over a few outcomes. There'll be a really short quiz. Really short. We're going to go over the 5 moments of hand hygiene, and it'll be more of a discussion rather than group exercise. I think everybody will be wanting to go home, and we don't want to make it too late. We're going to do look at a bit of VIP scoring for your IVs. Other strategies for infection control. It's not just hand washing, obviously. If we're going okay for time, there is a short video which I've managed to copy and paste onto the presentation, which I've never done before, so it's a miracle in itself. The practical exercise is the washing your hands and pushing the ultraviolet light on. We'll do a repeat quiz. Now, the idea of the quiz, it's my way of evaluating how well I've done the information and handed over the information. So I don't expect you to put your name on it. In fact, it's probably irrelevant that your name's on it. The first one is on one side, the second quiz is on the other side, okay? Now, in case you can't read the questions, when I get to it, I'll read them out, and just a very brief answer. And then excuse me, and then any questions. Can everybody hear me okay?
Mm-hmm.
Okay, please let me know. I tend to mumble when I get nervous, so there you go. Okay, by the time we're finished, we'll be familiar with the 5 moments of hand hygiene. Now, none of this stuff is new to you, I know, but it doesn't hurt to have a brush up. Okay, understand the value of hand hygiene and other measures in prevention of infection, and be confident in the use of the VIP scoring system. Now, I did try and get pictures related to VIP for the scoring system. They're not the best, but it's the best ones I could find. Okay, here's the quiz. Okay, how many moments of hand hygiene are there? I told you it was basic. Okay, yeah, that one might be a bit hard to read. Okay, what is the DHB policy for the length of time that our IV can be left in for? Just a very brief outline of what you understand that policy to be. Now, if I carry on too soon, let me know if you need a few more seconds. What does VIP actually stand for? Just hazard a guess. I wasn't actually sure either. What are at least 3 other infection control measures that can be used to prevent IV-related infections? There are quite a few, but if you could just name 3 if you can think of it. Be creative. It's quite okay. You guys okay? Excellent. You right over there? Oh, I can't see you. You're okay?
Oh, yeah.
You're cool. Okay, the last one is just match the activity to what you think which number of the moment of hand hygiene is. So just put the numbers in the order of what's on the other side. That noise doesn't help, does it? And as I say, the only person that's going to be looking at these quizzes is me, and I don't need your name. But I really appreciate the fact you're doing it. Everybody ready?
Sorry, I'm not.
Oh no, that's it. No problem. I don't mind waiting. It's only 3:05.
Can you read out the fourth one?
Oh yeah.
Can't see on the.
On the number 5.
Number 4.
On number 4. What are at least 3 infection control measures other than hand washing that can help prevent IV-related infection? So other things you can do to help prevent infection. I won't say what it is, but there is a strategy that's going around at the moment regarding IV lines, and that might give you a clue. I won't say any more, otherwise it won't be a valid comparison. Because what I'll be doing is comparing answers to the first go to the answers in the second time. Hopefully the information I give you will improve your answers if they need improving, that is. Everybody okay? Okay. No answers, so I'm assuming you are. Just let me know if I'm wrong. Okay, we'll proceed. You might need to look at your handout for this because it's a bit hard to read on there. That's as good as I can get the poster. So if everyone likes to have a wee look at these. There is one up here as well, in the middle. I was going to get you to have a look at them when you came in, but I forgot to tell you, I'm sorry. As I say, it's not new information, it's something you would have seen around before. If I'll read. I can't read it either, I can't see in the dark. Yeah. It's most unfortunate. That'll be one of the things I'll need to protect myself on, is that I can't actually read it. Yeah. So you've got before patient contact, you've got after patient contact, before procedures, after procedures and contact with bodily fluids, and also when you've got contact with the patient's immediate environment, like tables, etc. What I'll do is I'll give you a minute if you want to have a look at the poster at some point, and you can have a wee look.
316 is oxygen.
Yeah. Sorry. Okay. We'll carry on. Right, this is just when we were going to, gone too far, how do you go back? I haven't practiced as much, so sorry. Okay. So does anyone want to give me of any examples of pre-patient contact, before contact?
For ops,
Yes? What about one of the students?
Or pre-contact.
The pre-contact, what an example of a pre-contact?
So I think we were sort of, it's explained it as like when you go in to say that patient's area, you always
Yeah,
clean
yeah.
your hands, you go into the
Yeah.
area.
Basically, pre-contact is when you're contacting the patient or anything attached to the patient, like they're like you're turning the IV off or anything directly in contact with the patient. So it's not just the environment, anything that's actually attached to the patient. Yeah. Pre-procedure, what would you? Does anybody have an example for pre-procedure? What would you consider a procedure? So
You took the keyhole out.
yes, yeah, that's all it is. Yeah. Okay. Anything else? What is an example that we do with an IV? Giving IV antibiotics. Is there anything you're doing that's more invasive, not just touching the patient? Obviously, after patient contact is when you leave the patient after doing any of those basic things, not procedure, but like plumping up the pillows, that sort of thing. So once you've done that, that's another moment of hand hygiene. What about after procedure or contact with bodily fluids? What?
Empty an IDC.
Perfect example. Well done. Okay, I think that's enough of that. I think you've got the idea. And what about patient's environment? What's an example of that? Paula, what do you reckon?
Be the table.
Yes.
The table.
Yeah. If you've done the moments of hand hygiene on Health Learn, that's one of the examples that comes up. In fact, the video I've got is pinched off there. So most of you might, if you've seen it, let me know and we can just skip that bit. Okay, let's carry on.
As far as that green sign, and then back here.
Okay, VIP scoring. Oh, crikey. Can you read it on your handout? Okay. So VIP scoring, I thought it stood for visual inspection of phlebitis, but it's what I was reading was visual infusion phlebitis or something like that. So Angie, what do you think the I stands for? So I only found one example of what it stands for.
I thought it was infusion as well.
Yeah. It is on one of the
there.
posters, so
Yeah.
you'll be able to see it in a moment. Okay. A VIP score of 1, you're looking at slight redness at the site. Okay. If it's 2 or above, you've got more redness and possible early stages of phlebitis. So at this point, you really need to remove it. So they might have a bit of redness and a bit of discomfort that needs to come out. So at that point, you're doing safety first and letting the doctor know. If it gets to 3 or 4, God help you, because it should never. If it gets to that stage, and it could be either chemically related, like your antibiotics, or infusion reaction to whatever you're putting in it. Yeah. So and monitor, and the other thing it came up too is it may not actually have any phlebitis until for 48 hours. So when you take it out, you still need to monitor your IV site for up to 48 hours. So you're not necessarily in the clear when you take it out and they've got a score of 0. It could still happen. Yeah, wasn't really clear on that either. So the reasons you need to continue monitoring is you need to check for further signs of infection and also sepsis, because we've had people here before that their IV's been in, it's become quite sore and knotty, and so if they have a fever as well, you're probably developing sepsis there. I'll just make sure I haven't missed anything out. Would you mind if we had that lined up a bit?
Sure.
I think that might be why I can't read.
Yep.
Just the bloody. Yeah, I do that all the time.
Is that better?
Yeah, that's better. Okay. So the higher the number, you're going to get tracking up the arm. You're going to get edema and pain. But then you need to catch it early, monitoring at least once a shift. Take it out if it gets more than one. Keep observing it. And I, generally speaking, if it's 3 or above, I'll look at whether I need to send the tip. It's a waste of time doing a wound swab. It won't actually tell you very much. In fact, Sarah George doesn't really believe in skin swabs at all. If they like for cellulitis, you're probably better off doing a skin biopsy, which of course we can't do as nurses anyway. So I won't be taking swabs unless I'm asked to now. Yeah. Okay. Carry on. Okay, other infection control strategies we can do. You're looking at your no-touch techniques. When you're having anything to do with the IVs, you're not actually touching the port where you're putting it in. You can either hold it a bit further down, wear gloves, or like they do with the sea bags, have a gauze wrapped around it so you're not actually touching it. You're scrubbing the hub appropriately. Can anyone tell me how long you're supposed to scrub it for?
30 seconds.
Thank you. And what's the main thing to do after that? Thank you very much. Perfect. Having the patient aware that they've got every right to ask that, have you washed your hands? And I've only ever once been told that, but ask that, yeah. It's, yeah. Labelling the IV tubing is another thing, which we should be doing anyway, and I don't always remember to do it myself, is labelling and timing the tubing. Does anyone know how long you can leave an IV tubing, have it in use for?
Depends on what's going through it.
24 hours.
If it's IV fluids, up to 72, yeah. Oh, when we did intermittent infusions, other places I've worked, it always used to be 24 hours, but I don't know that that's actually in the policy. Am I wrong there, Angie?
TPN.
TPN is every 24
Yeah.
hours, but I'm not aware of any other actual thing. And the neutropenics we used to change every 24 hours, but I don't know that that's actually part of the policy here.
They've just updated the IV policy for SCDHB, so it'd be really good to just have a look through, see if there's anything new.
So I do suggest you have a wee look. I need to do the same. Okay, and what's one? We've got a strategy in place at the moment. You may have noticed the pictures around the ward with the printed out above it. It's using combi stoppers. They don't want us to piggyback it into the bung anymore, because I know for a fact, dare I say it, that people aren't scrubbing the hub when they do that. If you know they've done that, chuck it out and start again. If there's no date on it, chuck it out and use a new one. That's what I do. Because we're all responsible for what we do, so that's better to do that than me wondering whether it's clean or not, or how old it is. So basically, no piggybacking. Okay, I'm going to have a go and see if the video will work. If it doesn't work, we'll just carry on. So the main thing to think about is the negative consequences of an infected IV line, the added cost, the longer treatment. So you're better to prevent any issues rather than fix it when they happen. So let's give it a go. I can't guarantee it'll work. It did before, but we'll see what happens. I don't think it's going to work. Okay, one more try. Okay, let's give it a miss. It's not going to work. You've probably all seen it before if you've done the hand hygiene thing lately anyway. Okay, and my damn video's not going to work either.
There's a weird little thing up there. I wonder if it's trying to see how there's a verification information thing. I'm not sure.
It's not on my screen, so I don't know that I can deal with that. Well, I'm just going to wing it, so forget what's on the screen. Okay, I've done that. Practical exercise. This is where I get to shine the light on your hands and see. Oh, no, you need to wash your hands first. So would you mind popping out and washing your hands with soap and water at the nearest basin? And if you pop back, we'll see if the torch will work. We might need the screen down again now.
Do you want me to pause, like to stop the video and then restart it when they come back?
That'd be great.